First up is Aunt Bertha.
Okay. Thanks, everybody. So for the purposes of this conversation, I'm going to be using a term pretty interchangeably. It's the term seeker. So our company is based in Austin, Texas. There's about 65 of us, been around for a little bit over 8 years. And we work with health plans who call people members. We work with governments who call people constituents. We work with educational institutions as well as hospital systems. But we use the term seeker. And a seeker is somebody who's in need of services at any given time, or all of us at some points in our lives. This is a random picture of me dancing with my mom at a wedding. Now, this is my story. My mom caught a rare brain disease in 1992 when I was 17 years old called encephalitis, which caused permanent brain damage and permanent memory loss, where she lost 20 years of her life. And so I've been her legal guardian for the last 17 years and have experienced the mismatch between available social services programs and those that have special needs. Now, she requires 24-hour care, but it's been a meaningful part of this whole journey. In fact, that was my wedding, and she did her physical therapy and danced, and it was a beautiful moment. And I think that's there's two problems that we solve. One is when people are going through a difficult time, how do you find available services? So I'm going to talk a little bit about that. And then at scale, you can actually start to see trends that are happening out there in the community. And I'm going to talk a little bit about that as well. And then the second problem that we're working on solving, and we do in some cases, is once you find help, how do you start the process of getting enrolled? And how do you know what's going on out there in the community? So I'll share some examples of that as well. So our beginning started back in 2011 when we launched. It starts with a zip code. So for any zip code in the United States, you just punch into www.auntbertha.com. That service is a free service. Anybody can use it. And then we also license a white-labeled version of our service to our customers. Somewhere in here include large health plans, hospital systems, schools, educational institutions, cause organizations like AARP and the Red Cross. But I'm going to show some data on what's happening across the board. In the core of our team, based in Austin, 25 of which are 100% responsible for keeping the listings current and up to date. They do this all day long. We have hundreds of thousands of records for every zip code in the United States. And what's up here is a heat map of the search activity over the last 3 months. So you can get a sense that our users are coming from everywhere. And so I want to share a little bit of examples, a couple of examples that I saw that this room might find interesting. We have about 300,000 users in Texas. And I was surprised by this when I looked at this for a presentation I did recently. The number 3 search term is actually dental care, which I wouldn't have thought of. And so then I thought a little bit further and did a little bit more research and kind of came up with the question, does Medicaid cover dental care for adults in Texas? And it turns out the answer is no. And so at that level of volume, I wondered, well, does that theory hold up maybe in some of the other states that we work with? So California, we have about 125,000 users in California. Dental care is actually number 17, not quite as high. So I Googled that again, and California does cover dental care. And what's really interesting is we're seeing exactly the neighborhoods in which these searches are coming from. And in some cases, there is a wonderful nonprofit that can actually do an emergency surgery at a very discounted rate. We index all of those. But in many cases, it's just not there. So what do you do with that data at scale? Who do we get that data in the hands of? And our customers are very interested in that in the long run. And so that's kind of an easy one. We also work in some other unique situations. In New York City, they basically ripped out all the old phone booths. Apparently, we don't need them anymore. And and replace them with these high-tech kiosks. You'll see them in all 5 boroughs. And that's been happening for a couple of years now. And so I started looking at that data a little bit because I was curious. And the first time I started looking at that data was in January of 2018. Keep in mind, I didn't know this side of it yet, but I saw the volume going really low. Now, keep in mind, we live in Austin, and the first thing I did is I sent an email to my team saying, did we break something? What's going on there? And so I, fretted about it for, a few hours until I got an email back from my teammate that basically said, you've forgotten your roots. I'm originally from Buffalo, New York. It's actually freezing in New York City right now, so people aren't out there on terminals. But it holds up. And what's interesting is we see searches at 1, 2, 3 o'clock in the morning for, and in some sessions are in this order. 1, addiction recovery programs, spiritual counseling, anonymously, right out there in the open, sort of telling the things that they might be nervous to tell a human being to a terminal that's very non-judgmental. And so the first speaker spoke about the stigma. And I would say from the data that we see, the stigma is quite real. So take this a little bit further. We launched the same project in Philadelphia. Philadelphia is actually one of my favorite cities. This is a little bit newer, so there's not as much data there. And I wanted to share some other things that people were doing searches for. 1, clothes for work. They're finding some results. Help find housing. I think this is the reason I really love Philadelphia. They were searching for wine. Fortunately for our data team, there were no results, so that we didn't have subsidized wine programs listed. Unfortunately for the user, but you do see some really interesting things when you allow people to search anonymously. And we see searches for everything you could possibly imagine, very specific types of counseling, things that they would never say to another human being. And we just find that really not surprising and in themes of what others have said today. And so I looked a little bit yesterday about what is going on here in Arizona. And we have a strong network here. So I did a search of user counts, about 16,000 users across the state. This is where all their search activity is coming from. And a user in our mind could be, a seeker, somebody who's anonymously searching for things. It could also be a social worker or a care coordinator that's searching on behalf of other people. More conservatively, our user count is based on users that are searching for themselves or others, but doesn't include if they're searching for third parties, just to be a little bit more conservative. And so I became really interested in what the broader themes are across the state. And not surprisingly, housing is the #1 searched category across the state. Now, it varies in different locations, which shouldn't be surprising. So I thought, within the last 24 hours, what are Arizonans searching for? And somebody within 24 hours ago, anonymously, were looking for housing programs in Show Low, Arizona, not that populated. And based on how our model works, we have customers across the country that actually white label our search. So this one was coming from an association of primary care doctors. Somebody was looking for legal representation anonymously. Very important subject here in Arizona. And then somebody was looking for help paying for education. Now this one actually came through our channel, which was AARP, who white labels our platform and has a reach to a large number of seniors and are really trying to combat social isolation. And by putting services that are out there, maybe it's taking an extra class or maybe it's adult daycare, it really does take a village and lots of different people for different reasons trying to solve these problems. And our sort of belief in the world is that you can't solve all of this in a clinical setting. I don't think that's the case. I think it actually takes a lot of different interesting ways of thinking about it. And so I want to share a little bit about the second problem, which is, okay, great, you've found information, they're open, you think you might qualify for the service, what next? How do you get connected? So our approach, remember, we started down here and allowing for self-navigation for people in need on behalf of their families, and then something interesting really started to happen. Community-based organizations discovered us, started doing searches. Social workers at schools, prisons, community colleges. Many insurance companies use AuntBertha.com for free. Some of you guys, I want to talk to you about that, actually, which we're happy to do, actually, joking aside. But then our customers started asking for more clinical integration and became very interested in how do we make our care teams more productive. So over, starting 4 years ago or so, we started working with health systems and others and do integrations with many of the different EMRs and things like that. But what we found still, even when we were working in sort of a clinical setting, one large health plan that we worked with exposes a private label platform to their members that they market it through their own marketing materials, but they also provide a similar version of that to all of their staff who are making outbound calls based on claims data. And then what we found, again, was those members, when they weren't tracked, were far more likely to search for things that they would deem embarrassing. And that's a really important strategy in this whole thing, is the reach of your care team is really small. But what is the reach of those that are out there, and will they do some work, and will they level up? And I'm going to share a couple of ideas on how that happens. The broader part of it is, great, I have found something. What is our strategy for engaging the community-based organizations to actually do something about it? And there's, hundreds of thousands of them out there. Many don't have software systems, and so we started by building a very simple way of engaging on our platform, and it built over the years. Those things include simple referrals, this concept of screeners, so that they can decide. Is this one not working? Okay, yeah. So, so they can decide which questions that they wanted to ask every time they received a referral. And then also appointment scheduling functionality, very similar to ZocDoc, and this is sort of our public service. It's completely free. And of course, we're incented to have them engaged. And so we have about 1,000 CBOs a month nationwide joining our network, just topping 14,000, which means they have access to these free tools. I'll walk through some of those examples. Many of them do not have good reporting functionality, so when it comes to fundraising, they're kind of running around and looking for Post-it notes. So we have some built-in analytics as well. And this gives them the opportunity to log in, receive those referrals, and close the loop on those referrals. So Chris and I, while we were speaking, we decided we weren't going to bore you with features. And so I'm going to skip that. We can send some materials. But the broader point of it is we're successful when our customers renew and when they engage. And so we have natural incentives to monitor the health of the networks that are out there. And so for every state in the United States, with our team based in Austin, we monitor all of these different criteria. Red is the participating CBOs in the network. And it's going in the right direction because folks are finding out about it and actually getting value. I want to share a use case. We work with the state of Colorado, many of the foundations and CBOs in the state. For one project, we actually had 53 participating agencies who during a 3-month period made 18,332 what's called appointment referrals. And then because the closed loop percentage was pretty darn close to 100, we know that 14,000 people showed up to their appointments. And then we also know what happened. 7,420 were actually enrolled. And what's really interesting about this, if you want to start from the top and sort of drill in to help an individual person, is what happens to these other 7,000 people. Well, that data is stored and collected and made available if those people want that information to be made available. One other really interesting partnership is with United Way Austin. Some of the call centers that are out there maybe see self-service as maybe a competition, but we worked very closely with the United Way Austin, which is a great organization with a great new CEO. And based on criteria, the location, the time of day, and the type of search activities that were happening, and as real time as that's happening to the actual user, we prompt them, do you want to speak to somebody? And let's think about this. Every single one of you guys have call centers that you're funding and inbound numbers. And thinking about using that in a way that when that person is brave enough to do that search on their own, and maybe they are a member, You can find that out rather easily. How do you give them a nice nudge? So I just want to share that food for thought. Interestingly, of the 7,420 people that were presented that call option, 1.5% actually took an action. And this goes back to drive the point home of the stigma that's out there. I want to leave you with one last thing. And it's really all about context. And so one night, we saw somebody doing some searches from a suburb of Austin called Round Rock, Texas, home of Dell Computer. And you look a little bit more context. From 1:45 a.m. to 5:45 a.m., 4 hours, this person was searching and researching and clicking on things like cash assistance shelters from all the nearby area. Very interesting, certainly. And then you add one more bit of context. We subscribe to a service that lets us know, if it's public, if they're at a business or something like that, what the IP address is associated with. And in this case, it was a Motel 6. That tells you something really, really interesting. Who knows? Were these guys covered by Medicaid? They might be. And again, there's probably a health plan associated with the person. Maybe they cover them, maybe they don't. That might be able to at least talk to them, maybe help them through a situation. And so lastly, I spent 4 years with the Texas Health and Human Services Commission, improving the way people get enrolled in Medicaid, TANF, CHIP, and food stamps, and was really proud of the work that Texas did there by providing online renewals and things like that. And imagine if the Medicaid population, what's delivered now is just different 5, 7, 8 years from now. What if we said, just so you know, we might be able to get you some help. Do you want to speak to somebody? And then imagine delighting that member. I think we're a lot closer than you think. So with that, happy to answer any questions that y'all may have.